I'm Dave Harris from Evergreen Regenerative Medicine and Rehabilitation. Thanks for tuning in. If you caught our last episode, we talked about prolotherapy, which is a technique where we can inject certain substances into injured tissues in order to speed up their healing, and sometimes in order to establish some scar tissue in order to shore up injured ligaments or joints. Today we're going to discuss something that works on a similar principle, but maybe more robustly. It seems to be more effective than prolotherapy, seems to have a broader application profile, and most importantly, it seems to be much safer for the patient. This something is called platelet-rich plasma, or PRP. Now, platelets, everybody asks, well, why platelets? Well, for close to 100 years, our understanding of platelets has been that their only job has been to stop bleeding. If a platelet runs into injured tissue or some collagen, it triggers it to become real sticky, and it starts sticking to other platelets, and they form a mesh and then kind of run into whatever injured tissue there is and kind of form a clot to prevent further bleeding. That's what we thought they did forever. Over the past couple of decades, science has taught us that platelets have maybe a more important role than just to stop bleeding. And in fact, their primary role, we're learning, is that to start healing. So platelets are full of these tiny little granules, thousands of them. And whenever they become activated and become sticky and start to form these meshes and clots, they disgorge all of their little granules that are full of signaling molecules that can recruit other cells like macrophages to come in and clean up the damaged tissue, and blastocytes and other cells that can come in to lay out collagen and repair and regenerate. They've also been shown to recruit stem cells to come in and do their magic in terms of regenerating and growing new tissues. It's very exciting to watch how they work, and the more that we learn, it's just more and more fascinating every day. So how does it work for us? How do we use it in a clinic? Well, PRP, or platelet-rich plasma, is nice and it's safe because it comes from you. You're never going to be allergic to your own blood. You're never going to be allergic to your own platelets, and that's one of the wonderful things about this medicine. This medicine is you. So we draw out some blood and we'll put it in a centrifuge and spin it out. After it's done spinning, the red blood cells are all packed at the very bottom, and there's a little layer of white blood cells, and on top of that there's this serum, and in the very bottom part of the serum, that's full of platelets. We can extract out the platelets, and we can use those and direct them very precisely into the injured tissue. And as we do that, the platelets begin to take their effect and do their thing and disgorge all their healing signals and their stimulating molecules to recruit other cells. They start to do their thing. Over the course of weeks, these tissues begin to regenerate and regrow, and there's some exciting literature out there showing some of the things that these can do, both in vitro and also in vivo in humans. So the exciting part about this is every day we're learning new things that we can do with platelet-rich plasma. It started being used clinically probably in the 1980s by maxillofacial surgeons who were trying to fix big injuries in the face area and cleft palates and things like that, and needed to find a way to do that would minimize scarring. They became very proficient at it, and it began to become a much more exciting treatment option as it began to catch on into other branches. In the early 2000s, dermatology took it and ran with it, and they started using it for acne scars and stretch marks and other tissue injuries, non-healing wounds, things like that, with very good results. At about the same time, musculoskeletal medicine and sports medicine started using it for orthopedic injuries such as torn ACLs or ligaments or joint injuries, arthritis even, as a way of restoring the cartilage in joints. From there, it became very popular. You may have heard the story of Hines Ward, who had his big injury just before the Super Bowl, and they weren't sure if he was going to be able to play. He had a PRP injection, made some dramatic recovery, came back, and was integral in helping them win that Super Bowl game. Beyond that, it has been spreading into other specialties as well. It's now used in cardiac surgery. Gynecology started using it in the past decade or so, and they use it for skin lesions like lichen sclerosis of the vulva, also organ prolapse from the vagina. There's also good use for sexual dysfunction in females. Urology, not to be left behind, started doing it as well, and they use it for erectile dysfunction or other diseases like Peyronie's disease, which disfigures the shape of the penis. Even nowadays, the PRP is being used in dentistry. It's very exciting to see how it's used and how it spreads and can be applied in many areas. Most exciting to me is how I can watch it make a difference in my patients' lives. It's fascinating to me every time to see something so simple that the patient brought in with them applied in such a precise way in order to improve their pain and improve their function. I'm excited to discuss this more, and if you have any questions, please feel free to leave a comment or post, or please subscribe. I'd love to start a dialogue and discuss this more with you. And please, at any time, reach out and come see us. I'd be happy to work with you. Have a great day. Thank you.